So we are a national organisation, but we're very excited that we have an excellence centre based in this area as well. And also we have, as part of the excellence centre, we also work closely, very closely, like I said, with Anne Clark from Skills for Health, and Anne attends these meetings, and we're very excited to be working on the dementia work in this area. The National Skills Academy for Health see dementia care as one of the key priorities. So our priority really is to work with healthcare organisations to make sure that support staff have the right skills now but also in the future. So when we heard about this piece of work, we immediately wanted to get involved. We have worked on supporting Department of Health to implement the common induction standards and also the common core principles for dementia care. And I'm going to hand over to Emily, who's going to do the next bit.
So what are we trying to do? As in the introduction beforehand, we're going to be working with Health Education Kent, Surrey and Sussex and Memory Assessment Service staff in particular in the region, and we're trying to build a package to build on the good work that's already there and support people to empower families and carers and those living with dementia in the region. We're going to do this in 4 stages, and at the minute we're at the very beginning of it. So we're going to do some initial consultation and scoping and research. We desperately want to build a programme that's developed based on needs. We don't want to create something new for the sake of creating something new. We want to work with what's already there, look at what's working, look at what's perhaps not working so well, look at other training that's possibly out there, so see if we can complement that. And so this research stage is incredibly important because it needs to meet the needs of the people that we're trying to work with. Then move into our development stage. We'll have a bit of more of a consultation and just make sure that everything's all right and quality check what we've done before moving on to rollout and delivery. And although we have a particular quality assurance check, we will be applying our quality assurance mechanisms right throughout the project, and we will be evaluating everything that we do. So in a bit more detail about the initial consultation, and you'll notice that in some of them we've put little pictures in the bottom corner just so that you can meet some of the team who will be involved, who will be talking. So I'll be leading on this particular work with our very shy research team from Skills for Health, who weren't very happy about me providing a picture, so they became a little stick man. So at the moment we're very keen to engage with people. We've produced a podcast which tells people a little bit more about the work and who we are, which currently sits on our website, and we're keen for that to be shared with as many people as possible so people can start hearing about what we're trying to do. We'll be writing letters, we'll be emailing, we'll be trying to talk to people in the memory assessment clinics, but also people who live with dementia, families and carers, and also other healthcare staff, because it might be that something that's working in a different area might be very good for this project. So although we're particularly working with the memory assessment services, they are not the only people we want to talk to. We want to talk to anybody who has an interest, who has experiences, who has ideas. We'll be doing lots of social media campaigns using Twitter, Facebook, LinkedIn. So if you see we're doing something, please share it. We'd love to get the word out there. We're attending events like this, and we're running workshop sessions such as the one that we'll be running this afternoon. If you want to come and talk to us in a bit more detail to find out what we're doing, but also to start giving us some ideas, sharing some of your feedback on what's been working well and what hasn't been working well, we'd love to talk to you. We also have, we're also making use of My Health Skills, which is something our sister organisation, Skills for Health, has set up. It's an online networking platform where you can set up different groups for specific areas to have discussions and share ideas. We've set up 2 particular groups, one for healthcare staff in the region and one for carers, families and those living with the condition in the region. And we would like people to just start getting on there, sharing experiences, and also we'd love to see these being used after the project is finished as an ongoing place where discussions can continue, new ideas can bubble up, people can share experiences. So that's the engagement side of things. Moving more into the research, we are underway with desk-based literature research. So we've been reviewing literature probably from around the last 10 years around the area of empowerment and also around the area of carers and those with dementia, looking to see if from a literature point of view we can find anything that's working or not. There's a few common themes we're coming up with at the moment, so we'd be interested to hear people's thoughts on them. That there are key stages that every person will go through when they're living with dementia, but their journey won't necessarily be the same. So although they'll all go through these key points, they'll appear at different times for different people. And that a key area of empowerment where people would like support at the moment is decision making. So decisions around capacity, or decisions around at what point somebody should perhaps be put into a care home, and that sort of thing. And they're a couple of the themes that are coming out at the moment. So we'll be very interested in listening as to whether that actually reflects what you think or not. We will be conducting some telephone interviews so we can talk to people one-on-one about their experiences, what they think is needed. So if you're interested in being involved, please do come and talk to us. We'll be very happy to add your name to the list and to talk to one of our research team in more detail. We'll be releasing a survey to get some ideas, and when you see the survey coming out, please do share it with your network, share it as far and wide as you can so that we can get lots of feedback. Running workshop sessions such as the one this afternoon, as I've mentioned. We'll also start posting some of the key research questions on the My Health skills, so as well as having a discussion between yourselves, we'll be getting some of our ideas out there. And we're also hoping to attend some carer events to be able to talk to people. So if anybody's running any events like this, any cafes or anything like that, we'd love to talk to you and see if we can come along and just be a bit of a presence to chat to people as well. If we've done all that, we'll move to development. What we're thinking at the moment is that we will have a resource pack for our memory assessment staff that they will be able to use with training materials in it, or one-on-one support materials that they can use to go out to empower people. But that's just what we think at the moment. That could completely change. It all depends on the research. It will be to meet the needs to be able to deliver these empowerment sessions. And it will be myself working with my colleagues Samantha and David, who are from our development team. We've got extensive experience in training and development in the healthcare sector, and we'll also be engaging any dementia experts if it's appropriate at any stage for us to do so.
So before we go out to deliver, we're going to have to make sure that really we have a programme that's fit for purpose and is going to meet the needs of everybody involved. We do have a quality team within the National Skills Academy for Health, and they're responsible for really looking at any sort of training and development that we offer outward facing. So they will have a look at the resources in terms of quality of teaching and learning materials, but we really want other people to be involved in this process as well. So we will be engaging with people from the steering group, asking them to get involved to review the resources before they go out. We'll be going back to the research team to make sure that actually the resources that have developed do meet the needs and do focus on the key themes that have come out from that research. And we also want to engage with families and carers as well to make sure that actually the support is going to help them to meet their needs, because we're trying to hit two different target audiences here. We're trying to support memory assessment service staff to empower families, but ultimately the people that we're really trying to reach are the families and carers out in the community. So we really want them to be involved at every stage of the programme that we're running through. So the delivery of the programme at the moment, what we're thinking about doing, but again this is all up in the air at the moment because we really want to make sure that it's meeting the needs. But the method of delivery that we were thinking of would be to run 3 workshops which would focus on workshop skills, training and development skills, as well as going through the resources in a train the trainer type programme. Then allowing people to be able to go out and deliver those sessions with people out in the community, feeding back to us, do they feel that they're supported, are they working, is there anything else they need a little bit more help and support with? And then doing a final session at the end where hopefully we can adapt and tweak any of the resources, do some more resources if needed, and provide another support session before people go back out again. And the final part is evaluation. So we will be evaluating at every stage. I think everybody's looked at evaluation as part of their presentations this morning, but it really is important to make sure that we're able to build on the best practice, build on the lessons that we've learned, and make sure that we are making a real impact. Like I said, we are a national organisation, and as an organisation we really value sharing best practice. It's one of the reasons we started to think about setting up excellence centres in all of the regions. So we want to learn from the lessons that we find here, share best practice through the networks, through the region, but also hopefully we'll be able to help you to make links with other people throughout the country, up in Newcastle or Durham, and be able to share best practice across the country as well, because there's a lot of really good work going out there and it would be a shame not to be able to share it.
Mary was saying, what do we need you to do? And it's very much what I was talking about in the research and development. In essence, talk to us. Please talk to us. Share your experiences. Give us your feedback. And there's great ways to do it. The phone interviews, the surveys, and our forum groups. And also, if you're a healthcare employer in the region, we have launched a dementia resource library on our employer partner website. It's a collection of different resources that are available to use, but also that you can discuss as well to see if they're useful or not. There's bits of e-learning, there's articles, there's all sorts of different things on there. And if you're an eligible employer, which most healthcare employers in England are, it's completely free to access. Come and meet us, just come and talk to us. Thank you very much, and if you've got any questions, please do ask us at any point in the day.
Thank you.